Managing High Risk Together has been developed by the Manchester Safeguarding Partnership to promote a multi-agency approach to the assessment and management of risk for adults who appear to have capacity, may have care and support needs, and who are deemed to be at high risk of serious harm or even death, and multi-agency escalation is required. High-risk cases include people with complex illnesses and disabilities, including mental health issues, dementia, complex trauma, learning disabilities, long-term physical health needs, and people with chronic self-neglecting behaviour, for example, substance misuse. These cases are high risk and there is often a need for a coordinated response. Managing high risk together may be required when an adult who may have or who has care and support needs has been identified as being at risk of significant harm, is known to one or more agencies with repeated concerns of presentation, but there is no established effective plan, or there has been ongoing unresolved issues to secure multi-agency working to manage ongoing needs. And the person has the mental capacity to make relevant decisions but has refused essential services or interventions, which could result in significant harm. Or there is doubt about their capacity due to their circumstances or behaviour or external factors such as undue influence. Thus, this can include fluctuating mental capacity. And current management approaches have not been able to mitigate the risk of this significant harm. And there is a concern about the individual's ability to manage their personal care and hygiene, home environment, activities of daily living such as shopping, health conditions, finances, safety, protection from abuse and neglect, vulnerability of exploitation, comorbid conditions, parenting and caring ability, and repeating behaviours or ability to carry out a decision, causing professionals to question their capacity. And one or more of the partners have concerns about the individual and believe a multi-agency discussion would be of benefit. Before using the procedure in managing high risk together, you must ensure all other case management and safeguarding adults policies and procedures have been followed and that you have escalated your concerns within your own organisation. The individual case has been brought to risk management and safeguarding supervision, yet the risks remain and require a high strategy approach. The effects of coercion, undue influence, addiction and trauma, for example, on a person's decision-making and executive capacity have been taken into account and capacity has been assessed as far as possible. Mental capacity assessments are evidenced and recording working out is clear in respect of the decision to be made. If there is already an allocated worker within the health, mental health or social care agencies, the concerned practitioner should contact them and request a multi-agency meeting. The lead professional should be a professional from the agency with the most significant involvement with the individual on the person's primary needs and concerns. If there is no identified lead professional, the concerned practitioner will need to take responsibility for coordinating a multi-agency meeting. The lead professional should be a professional related to the primary concern. For example, if the primary concerns are related to a health condition, the lead professional should be a healthcare professional. The identified lead professional should make contact with the relevant agencies to secure their attendance at the Managing High Risk Together meeting. If an agency needs to become involved with the individual, the lead professional should ensure the appropriate referral has been made. If there is a formal advocate involved with the person, they should be invited to the meeting. If they do not have an advocate, consider if one is required or if the person or family or friends should be invited. The meeting should be chaired by a senior manager. For example, in adult social care, this should be an assistant director or delegated to a service manager from the team service area of the lead professional. The person's capacity with regard to the decision to be made should be confirmed at the beginning of the meeting with evidence as to why this is thought to be the case. The purpose of the meeting should include an overview of the person's views and wishes or those of their family and loved ones. Should be available at the meeting wherever possible. If they aren't engaging, do professionals know why? A summary of risks and proposed actions, including the need for ongoing monitoring by agencies to mitigate them, should be completed at the meeting. The meeting should produce actions with timescales for implementation and agreed date for review by the lead professional. At the review date, the lead professional will request an update from partner agencies, establish the views of the person or significant others where possible, and discuss the case progress with their supervisor before deciding if the case can now be closed or if a further Managing High Risk Together meeting is required. Managing High Risk Together sets out to clarify the roles and responsibilities of agencies and identify a lead professional and what legal powers and frameworks are available to agencies. If the person lacks capacity, they must be assessed under the Mental Capacity Act. Before using Managing High Risk Together, all policies and procedures within the agency must be followed, the case escalated to managers and discussed within supervision. If you feel that the case requires a further level of escalation and a senior multi-agency approach to resolve, please refer to the Managing High Risk Together policy. For more information and a copy of the Managing High Risk Together policy, please visit manchestersafeguardingpartnership.co.uk.